I did open the meeting, call it to order. And are you sure I don't need to turn off this other microphone?
I don't think we need a PA.
What if I hit the microphone? My apologies to anyone watching online. We're trying to get the PA system set.
John Ames. Did we lose John Lee?
He's working, he's there.
Oh, okay.
They traded places.
And the PA is not on? What am I hearing?
Okay.
turn that
So,
down.
so we are good now.
And
Mr. Carla, can you hear me now on the Zoom? Okay. All right. So I did call the meeting to order at 6 p.m. And I am asking for I am making a roll call vote. Mr. Doherty.
present.
And I am here. Ms. Pettit.
Here.
Dr. Swetchenow.
Here.
Mrs. Washburn.
Here.
All board members are present. I would ask for a motion to adopt the agenda for the work session.
So moved.
Mr. Doherty moved and Ms. Pettit seconded. And you do have the agenda in paper in front of you. I don't believe there were any changes from the agenda that was posted on board docs. Any questions or discussion about the agenda? Seeing none, can we have a vote? And I would vote aye. Ms. Pettit,
Yes.
Dr. Swetchenow,
Yes.
Mrs. Washburn,
Yes.
Mr. Doherty.
Yes.
Motion carried. The first item that we need, because we do not have a treasurer, we have an interim treasurer serving right now, and he is not able to be here this evening. So we need to elect a treasurer pro tem. I would move to elect Mrs. Washburn as treasurer pro tem for this evening. Is there a second?
I will.
Yes.
Oh, Eric can.
Dr. Swetchenow seconded. Mrs. Washburn, are you willing to serve as treasurer pro tem?
Yes.
All right. Any questions, any discussion? Anybody else want to vie for the right to do so? All right. Then I will call the roll on this, and then it'll be up to you after that, Mrs. Washburn. So Ms. Pettit,
Yes. Yes.
Dr. Swetchenow,
Yes.
Mrs. Washburn,
Yes.
Mr. Doherty,
Yes.
and I vote yes, so the motion carries. All right, then moving right into our first, our discussion topic, and that would be COVID protocols. I believe that Mr. Broadwater has a presentation. I don't know that the presentation will be projected anywhere.
I don't believe so. It's on board docs.
It's on board docs. Okay. All right, very good. I'll turn the floor over to you, Mr. Broadwater.
Thank you. To Board of Education, just a short note, I did have some more things to say, but I know we've got a lengthy discussion this evening, but I have completed my. Oh, I have moved that. You can hold the space bar down. Oh. All right, it's my first meeting.
You have to hold it. You either have to hold it or just click on your picture.
All right, thank you. Well, good evening again to the Board of Education. I did have a little bit of an entry point discussion, but I know we have a lot to discuss this evening, so I'm just going to limit it to say, after a week and 2 days in the superintendent seat, it's been a great week and a half. I've met many, many people, and obviously in July and June, and went to meet to the team last night, and everybody's just been so very, very welcoming, and I'm excited to greet our kids, greet our staff. We have our staff opening day on Monday, and I'm excited to meet them. So with that, I do want to get into the presentation so that we have time for discussion. The presentation, I'm going to go ahead and share on the screen. And basically what I would like to do is kind of go through what we're looking at for this year, and then allow for discussion. But expectations for this school year, 2021, 2022, we are committed to the health and safety of our students. We know that we're going to have to respond and adapt as things change. That's just the way things have gone for the last year or so. We know that we have to do that, and we have to make sure that we're doing it based on data and making sure that we're being very responsive to what's happening in our classrooms and in our schools. We are going to follow the requirements, and we're going to consider the recommendations of the Center for Disease Control, Ohio Department of Health, Hamilton County Public Health. We have those three layers that we listen to and we get our recommendations from. We will continue our mitigation strategies with hand washing, cleaning, other protocols. I was told last year it was called the bundle for our staff. So we are calling it the bundle. It may be bundle 2.0 with mask or not mask, because that was mandated last year. But we are going to keep the same mitigation strategies in place as it went very, very well last year. We know as educators that students benefit from in-person learning, and safely returning to in-person learning is a priority. So the good news out of all of this is last year, we were not looking at returning in person. We were trying to figure out virtual and remote. So we're in a much better place this year. We have the vaccines for those that take advantage of it. So I want to make sure we're looking at the positives, that we do get to educate kids right from the start this year. The district, tomorrow, our district, we are going to communicate our building plans. We are going to have it come out from the district, and it will be building specific. So you'll see from each building the plans, and you'll notice they're very similar to last year, in fact, the same. The next slide I've got is health data for summer programs. This is a little bit of data to look at. It's all we have. I know it's a small sample size, but we have athletics and summer school. Okay, and so athletics, we had 2 coaches test positive on July 30th and July 31st at the high school. Those were contracted outside of the school setting. We had approximately, I asked our athletic director, Brian, we had approximately 150 students go in and out of our fitness center with 11 teams, and we did not have a positive case in the athletic center. For summer school, K through 4, we had 244 students with 20 staff members. We had grades 5 through 8, we had 124 students with 19 staff members. There were no close contacts in the buildings. The masks were optional in buildings. Masks were required on buses because that was your federal mandate that we have to follow until September 13th. We had 1 student test positive, which was considered a community case. In other words, outside of the school setting. 5 students quarantined due to exposure outside of school. So that's just a small sample size, but it does give you something to look at. The Center for Disease Control, these are the guidance recommendations as of August 4th, 2021. We all know students benefit from in-person learning, right? We want them in class. Vaccination is the best strategy to end the pandemic. Due to the circulating and highly contagious Delta variant, CDC recommends universal indoor masking by all students age 2 and older, staff, teachers, visitors, and so on, regardless of vaccination status. And that was released by the CDC. In addition to universal indoor masking, CDC recommends school maintain at least 3 feet physical distance between students within classrooms to reduce transmission risk. Next bullet, many schools serve children under the age of 12 who are not eligible for vaccination at the time. Therefore, their guidance emphasizes implementing layered prevention strategies, which is the bundle, but also then the masking from the CDC. The Ohio Department of Health is the next layer that we take a look at. And the Ohio Department of Health, this was August 5th of 2021. So we did receive guidance on August 4th from Hamilton County, and I had put out a video to our parents that kind of stated this, but on August 4th, Hamilton County, we did receive guidance. August 5th, the Ohio Department of Health put out their guidance, which was a little different. So then August 6th, Hamilton County came back and adjusted it so it matches the Ohio Department of Health. But the Ohio Department of Health strongly recommends vaccination for staff and eligible students, strongly recommending use of face masks in K through 12 settings, particularly for those who are not fully vaccinated, maximizing distance between people, which is part of what we do, prompt identification and providing appropriate care for people exhibiting symptoms of COVID-19, practice good hygiene and routine environmental cleaning and disinfection, which again is something that we do. So I won't go. The next slide is the flow chart. I explained it on the video, so I don't want to do too much of a deep dive into it. But basically, if you have universal masking, we'll be able to control the quarantine simply because the individuals that are masked can safely remain in normal in-person classroom. If there is not universal, there really are two levels. One level is vaccination. So your kids that are 12 and up can get vaccinated. If they are vaccinated, they are probably not going to have to quarantine unless they don't meet the 3-foot rule, which we believe we can maintain. Not 100%, believe we can. The next level is if they are not vaccinated, if they wear a mask, then the student will not have to quarantine either, as long as they don't violate the 3-foot rule. And then lastly, the contact would have to quarantine if they don't meet those two levels. From an educational standpoint, as a parent, if you look at that, basically what it says is if your student is vaccinated, they're probably going to be able to stay in school. If they're wearing a mask, they're probably going to be able to stay in school, and you won't have the large number of quarantine numbers that we have seen in the past. But that is from the Ohio Department of Health, and Hamilton County Public Health has adopted that. Based on our conversations with Hamilton County every Friday, I meet with local superintendents and the Hamilton County public health officials. They are going to go with Ohio Department of Health. Quarantines will be required based on contact tracing guidelines, and they are the ones that lead that. So Hamilton County will be leading the quarantine. The bundle, the mitigation efforts are going to continue. As I stated before, masks will be required on buses through September 13th. And then you'll have one of two things happen. One, that mandate will stop, or they could extend it. And that's up to the Department of Transportation with the federal requirements. Physical distance, we are going to keep 3 feet when at all possible. We are going to have assigned seating. Hand washing and sanitizing will continue, cleaning and disinfecting. Contact tracing, we obviously have to do. We are going to maintain the weekly data dashboard that we are going to share on the website. And the vaccination status, and people have been asking about that. We are not going to ask for that. If it's, we may optionally ask if we have to go through contact tracing, but the only time that that would be required is if there's contact tracing, and that's per the Hamilton County Department of Health. Our plan, very simply, vaccines are going to be recommended for staff and students who are eligible, as that mirrors exactly what CDC is saying. Masks are strongly recommended and encouraged for our staff and students, but not required at this point with the resolution. Maintain 3 feet social distancing when possible. Our goal is to protect students while giving parents a choice right now with the resolution. We are going to maintain the dashboard, and we're going to monitor and respond as needed. And to our parents, I would also remind that if your child is not feeling well, if they have a fever, if they have a runny nose, it's very important that we don't send our children to school ill, as that can add to the spread. So kind of what I would like with the board, kind of give you a decision framework. If we look at being able to pivot and what are different decisions that we could do. We have a classroom level decision. If we see that there's a classroom that possibly is having issues, we could do a classroom level decision or pivot, which means it could be masking, could be quarantine, whatever that may be. We could look at certain grade levels if it's in the building and we feel that it's an issue with the grade level. We could look at building level. We could look at pre-K through 6 grade band, since those are the kids that do not have the ability to get to the vaccine. We may have to look at that. And then also district-wide. I know my goal as a superintendent, I'm not a medical expert, I'm an educational expert. I want kids in class. And so the best way to keep kids in class is vaccinations and to mask. It's very simple. I'm not saying I'm a medical expert by any means, but educationally, the way Ohio Department of Health has the guidelines set up, if your child is masked, we probably will not have to quarantine, and if they have their vaccine. So lastly, and then I'll turn it over to Dr. Lorenz, what we're asking our students, staff, families, community members, everybody, this is just a team effort so that we can get through the school year. I want to look at it as the glass is half full we got kids in the building. Okay, we're going to start with education. We are going to make sure that we take care of our kids as much as we possibly can. There are no guarantees with this. There are no guarantees. And so these are very difficult decisions. And I hope everybody understands these 5 board members, myself, my leadership team, these are difficult decisions. And these are decisions that leaders have to make, but we don't make them without looking at a lot of data. I know all of these board members have been working very, very hard, answering emails, trying to get back to everybody. And so I hope everybody understands these are very difficult decisions, and we want to do what's best for our kids at the end of the day. And so, Dr. Lorenz, I will stop there and turn it over to you.
Thank you, Mr. Broadwater. And board members will have the opportunity to obviously ask questions, have discussion. I have a short summary for the board and for the public, since we don't have a hearing of the public section for a work session. But as board members know, we have received quite a bit of input concerning this. And so I will briefly summarize. I believe that every board member has read all of the things that have come into us. But I thought it would be helpful if I gave a brief summary. By my count, and it is not verified by Price Waterhouse, by my count, we have received emails from about 150 individuals. We have received more emails than that, but if I count who sent an email and then who responded to an email and who sent additional information, we have about 150 emails. I cut off the counting at 4 o'clock. A couple have come in since 4 o'clock, but at that point, not all of those emails some of those emails were from parents, some were from teachers. We had 2 student emails come in. Some folks identified themselves as community members. Some folks without children, many folks identified themselves as parents and talked about specific student information. And they shared their health concerns or the difficulties that their children had with masking. Some people just asked questions. Some people identified themselves as medical professionals. So the number that I'm going to give you, we have about 150 people who contacted us, but the number, if you break it down, the number who asked for the mask policy to remain optional was 73. Those who asked for mask mandate was 70. So it was pretty evenly split. There were emails ranging from pleas for masking to demands for choice. I saw a little irony in that, but that's okay. That's, this is kind of strong feelings here. And then everything in between. I did, as Mr. Broadwater mentioned, try to answer almost all those emails. I was away for a few days, so Mr. Doherty answered a few for me. For anyone who is listening, if you did not get an answer to your email, it was simply a missed communication. The way the emails pile up, sometimes if Mr. Doherty responded or things happen, and I may not have responded to all. I may have only been able to respond with we got the email, the board members have seen the input. There were 2 emails that mentioned petitions. There was a petition that was sent, and that petition was for masking choice. That had 139 signatures. There was also a petition that was started for a mask mandate, and at 4 p.m., that petition had 310 signatures. I don't think that the board is looking to have this information quantified. I don't think there's a sense that this is the information that needs to be used as far as masking. I will ask the board one question. 2 of the communications that came in asked for things to be read this evening. We don't officially have a hearing of the public. Each board member has seen what was sent. So I will simply ask the board if there is a desire to have those 2 things read. I can do that. I can ask that they be put into the minutes, or we can simply confirm that as board members, we have read them. I think the board members who read the emails know the ones that came in. And as it happened, One was a request to read a request to keep the masking policy optional, and one was a request to read the petition that was signed by 310 people asking for a mask mandate. So they're, again, split down the middle.
Kathy, just an idea about how long it will take on each of those, do you think?
They're each a printed page.
I don't know how everybody else is, but I think there's been so much interest in this subject that it'd be fine just to go ahead and take a few minutes and read both of them. I think we can assure the public that, my email folder on this has 200 emails in it. I know I've read every single one of them and responded to a good number of them. So, and I think that's true for all of us. So we have been hearing pretty clearly where the public is at, but I think it's fair to go ahead and take a minute to do that.
Without doing a vote to suspend rules, I'm looking at the table. If you are in agreement, I will read these two.
Quite honestly, if the rules that we typically have for work sessions are not to read things into the record, then I'd rather not do it, and that we can attach them to the minutes.
Okay.
It's not very often that people write in and ask to be shared in the meeting, and I feel like we should give them each a voice.
I'm trying to think through. I don't disagree with Eric, but also I don't disagree with Michelle either. I don't have a strong opinion one way or the other, especially since one is for and one is against, and we've received several hundred
Right.
emails. So if
I think
people want to read them
I'm going to
and
make a
they want to be
suggestion that
heard,
the
I'm fine
best
with
way
that.
to proceed, since I'm hearing different things from the side of the table, is ask for a motion to suspend the rules of procedure for this meeting to read two letters into the minutes.
So moved.
Second.
So Mr. Doherty and Ms. Pettit made that motion. Any further discussion? Then we can vote on that motion. Let me see where my voting is. You are voting on, if you vote yes, I will read the letters. If you vote no, I will ask that they be put into the minutes. So Ms. Pettit,
Yes.
Dr. Swetchnow.
No.
Mrs. Washburn,
Yes.
Mr. Doherty.
Yes.
And I would vote no and put them in the minutes, but 3-2, the motion carries.
They'll be in the minutes regardless. won't
They'll be
they?
in the minutes regardless, but yes, the 3-2, I'll read the letters. I probably could have read them both by now, but anyway, here we go. Okay, the first letter that was received is from the Gatsos family. It says, "Hello, Loveland School Board. We would like the following to please be read aloud and responded to at the August 10th Loveland City Schools Board meeting. We realize that many people are tired of wearing masks. We are tired of wearing masks. However, wearing a mask is not an infringement on one's right or liberties. It's a minor inconvenience to protect the health." I made a mistake. I've read so many emails. Okay, so they're both for a mask mandate. Sorry about that. It's a minor inconvenience. One's liberties become limited when they may harm others. Not wearing a mask can harm those children who are too young to be vaccinated, such as our son. The current dominant variant of COVID, the Delta variant, does not spare children and young healthy adults as the previous variants tended to do. Infections are increasing at an alarming rate in the US right now, according to the CDC. Younger adults and children are becoming very sick as the variant spreads, with hospitals in some parts of the country running out of ICU beds again. According to my children's pediatrician, data from the 2020-2021 school year shows that masking is what prevents the spread of COVID in schools, more so than distancing, plexiglass barriers, etc. Data is also showing that vaccinated individuals are able to carry the virus to those who are not vaccinated, children under the age of 12, and the vulnerable, both at home and students, faculty, and staff who may have conditions, making them more vulnerable to the virus. Data is still being collected and our actions have to change with the newest data. We have a responsibility to follow what our best current data shows, which clearly leads to universal masking. Our children cannot learn unless they are healthy. The board's most important function is to keep our schools open so our children can learn. Therefore, Loveland schools need to implement universal masking to prevent COVID outbreaks. Caving to the pressure of those who want to pretend the pandemic is over or fake or fear-mongering is a direct violation of your responsibility to our children and our community. Please do not wait until students, teachers, and others in our community become extremely ill, or heaven forbid, when people pass away, to do what is clearly right for the health of Loveland students and community. Thank you for your time and consideration. The second that was asked to be read, again, these are simply the two that asked to be read at the meeting, is a reading of the petition that was circulated concerning the mask policy. This petition says the mask policy that was instated at the beginning of June 2021 for the Loveland City School District occurred at a time with a very different COVID-19 landscape and is no longer a safe option for our children. Child and teen COVID-19 cases jumped 84% in our country in the week of July 22nd to July 29th. Additionally, all counties surrounding and encompassing Loveland, Ohio have now been labeled as substantial or high risk for COVID-19 transmission by the CDC. At a time when the Delta variant, a much more highly transmissible virus, is spreading throughout our country and local counties, we need to reinstate a universal masking policy, a policy that kept our staff, students, and families safe last year. In-person learning is extremely important for the mental and developmental well-being of our children, and by abandoning a prominent safety precaution, we run the risk of not only widespread illness, but quarantines and a return to remote learning. While some or all of the staff and teachers will be vaccinated, our children under 12, as of yet, have no such option, and evidence indicates that vaccinated individuals are just as likely to transmit it to others. Not only have the American Academy of Pediatrics, the CDC, and the Ohio Department of Health recommended universal masking in schools, so have local medical professions, including Cincinnati Children's Hospital. Schools should be a safe place for children. We need to rely on medical experts for guidance, just as we rely on educational professionals to teach our children. By leaving the decision of mask wearing to the parent or guardian, we are blatantly and brazenly ignoring the advice of medical professionals and discounting the health and well-being of our students. So those there were two that asked to be read. I will finish my statement about information we have received. Since we do not have videotaping of this room, I will simply note that we do have an audience at this time that is indicating that they are in support of a mask optional policy. So I'll put that into the minutes as well. All right, so that's the summary of what we've heard. Are there board statements or questions? I think for myself, Mr. Broadwater answered a lot of questions when he mentioned what the bundle would be, continuing with the 3-foot distancing, the urging of masks, a variety of things. And so I'll open it up for board statements. Mr. Doherty, I saw your hand first. I happened to turn that way, so I'll let you go first.
Thanks, Kathy. And thank you to the audience for being here tonight. We appreciate you. Appreciate how passionately you feel about this, I presume. We've seen it in the emails. We get that, okay? I also appreciate the decorum that you're exhibiting tonight, letting people do their jobs here. That's what we're here to do in public and transparently. So I appreciate you letting us do what we have to do. So thank you again. So I have a few things that I want to say, and bear with me. This will take just more than 2 minutes, but I've gone over and over and over this thing and just feel it all needs to be said. So let me start with saying that I think this is a good time to use the same critical thinking we say is imperative to teach our kids as we assess the risks of COVID, its Delta variant, and appropriate mitigation strategies. Our primary mission is the education of the kids in our care, but their safety and the safety of our employees is also critical. Board and administration decisions are intended to drive much of that, but individual decisions by everyone in this community plays a key role as well. A little too often, we have sweeping governmental or health authority guidance that doesn't tell you how it was arrived at, nor its supporting data. Without what I call the why underneath the guidance, we're often left unconvinced. And finding credible research and evaluating it to make fact-based decisions take some serious effort. This is not a prop, but this is the research that I've gone through this week. I've read every page of it. I had to find every page of it, and I've read it all, okay? I'm going to cover essentially 4 points. First is that Delta is a new type of threat, and it's real. Number 2, vaccines are a critical weapon in dealing with COVID. Number 3, masks, while not as effective, are an important layer of defense. And 4, recognize the input we have received and how we should make decisions. And I'll make comments about all 4 of those general areas. First of all, in terms of it being a new threat, the Delta variant is like COVID, like the COVID we've been fighting, but it's not the same. It's the result of nature at work in the replication of billions of copies of itself every time it infects one of us. And every so often, a variant ends up being a more efficient version of its parent, and we end up with a virus that is much more transmissible, more resistant to vaccines, and thus more dangerous than last year's COVID. Research is building on that, but recently 2 Indiana school districts that opened earlier this month encountered infection rates of about 0.5% that led to quarantines of between 5 and 10% of their student populations in their first week of school. Those infection rates are as high as our peak of all of last year with the original COVID. Quarantines are designed to stop so-called exponential growth, but in the process could quickly progress to a real challenge to maintaining in-person learning. And that's something that none of us wants to see happen. Viruses' exponential growth are always small at the beginning, but can grow shockingly fast. With Delta, research is indicating one person may infect 3 to 4 others, and each of those 3 to 4 may infect a like number. So one case can turn into 20 in a matter of just a few days. And it spreads faster and faster until something ultimately stops it. This is a much higher rate than the original COVID. Last year, we took some solace in data showing kids typically seemed to have natural immunity or suffered mild symptoms. More recent data is suggesting that it's not the case with Delta, but the research is still early. The biggest concern I've seen is the risk that as the virus continues its replication, it can eventually produce a variant that is resistant to our vaccines, and we start all over again with yet a higher level of threat. That's an important and additional underlying reason to seek high levels of vaccination in the population and slow its spread. On vaccines, fortunately, the vaccines we have are highly effective at limiting the impact of a Delta infection. Science tells us that so-called herd immunity takes about a 70% vaccination rate to put up a serious roadblock to a virus making headway into the population. Unfortunately, our community at present has only about a 50% vaccination rate amongst its eligible population. And our youngest can't be vaccinated at this time. So in contrast to the community at large, we have around half of our student population that is completely exposed. The data is strong on safety, vaccine, and effectiveness. And it makes sense to use the most effective mitigation we have to fight this thing by everyone getting vaccinated who doesn't have a medical contraindication. Anecdotally, this is a disease you don't want to get. I'm told by people that I know that ICU COVID populations are up. The patients are younger than last year and are typically unvaccinated. Onto masks and layering defenses. We use something called the Swiss cheese model. Sorry for that term, but it's what we actually use. Use this in the business world for decades. The idea is simple. Typically, a single mitigation isn't 100% effective. Think that vaccines being 90% plus effective, perhaps, but still you have the so-called breakthrough infections. A number of viruses make it through one hole in the Swiss cheese, so you end up putting up another layer of mitigation to stop some more of what made it through on the first one. Think masks in this case. They're less effective, but the data is strong that they do add a layer of protection. The millions of viruses an infected person exhales encounters a barrier. Some get through because they are so incredibly tiny, but it turns out not all of them. That has been the primary reasoning for wearing masks, to keep the virus more to yourself and slow the spread to others. The research tells us that the most infectious period are the days before you even suspect you have it. So the risk is that you are spreading this thing unknowingly, hence the push for universal masking. There's also research that suggests a similar but lower protection level when hailing through a mask from a virus that has come from others. Less effective still for sure, but studies have shown something overall between 20 and 50% effectiveness. Given the challenge of kids actually wearing masks or wearing them correctly, effectiveness is likely lower, but it's still a layer. So if you do both these primary mitigations, vaccines and masks, and
Guys, please save comments for when you're out of the room. Thank you.
is it okay if I continue? Thank you. Okay, let me continue. All of us spent untold dozens of hours reading hundreds of emails. We listened, okay? And it'd be great if you just let us do our jobs. This meeting isn't set up for that.
I need order in the room. This is not the setup of that meeting, and we have certainly received a lot of public input. It's not that we have not listened to public input. It's our ridiculous. Pardon? There are other public means to contact us.
There are generally 2 meetings a month. These were planned back in January. You can see them. They're publicly listed out on the website. One of those meetings is set up this way, which is where we try to work through the business of the district, and we try to have conversation about the issues of the day. We generally don't do motions or make policy in this meeting, although it does occasionally happen. The other meeting is called the business meeting, and that's the meeting where we invite public participation. And that meeting, Kathy, is when? Next one?
The 31st.
The 31st of the month. So a few.
Excuse me, it's not in order to ask questions. We will stop what the statement is, but this is the time to have board members discuss what their thoughts are on the start of school and COVID protocols. That's all that's happening here, is board members are making statements. And I'm sorry, I'm muted for those who are not in the room. This particular section is for discussion. Mr. Broadwater has presented his outline of COVID protocols, and the time at this point is for board members to present information that they have and have discussion and questions about that protocol. So I would ask Mr. Doherty to continue his statement.
So again, I thank you for your indulgence here. Please let us do our business, and we'll get through this and we'll see where we end up later tonight, okay? I think what I was saying, so if you do both of these primary mitigations, vaccines and masks, and then add more layers like distancing, improved air circulation, and sanitizing, you start to create enough barriers that the chance of getting through all the holes in the Swiss cheese gets really small. All of this drives the conclusion that a multi-pronged strategy of strongly emphasizing vaccinations and masking, plus doing the other things that make a lot of sense in battling this threat and its potential future variants. And the best time to implement these strategies is before Delta has a chance to get a foothold and keep it from getting a strong base to exponentially spread from. So that leaves us to how do you process all this and how do you make decisions? The question becomes how to implement these various layers of mitigation. Our society is built on the idea of the common good ultimately prevailing in our decision-making. We also fiercely believe in individual liberty and choice, so mandates should be limited and focused as much as possible and used only when necessary. Maybe as importantly, I really want to believe that we have some shared values, including caring about the welfare of others, and we would agree our right to choose shouldn't hurt others as we exercise that right. How should we be caring about all of the children in the schools, our own as well as our neighbors? As a school board, that consideration is mandatory. We have to consider that. As parents, I hope it's just naturally part of our nature. I do. And if all this logic holds, we would agree that universal masking makes sense and mandating it wouldn't be necessary. Our respect for others would motivate us to voluntarily do the very disagreeable and imperfect step of masking. Maybe even if we didn't believe in it, but allowing for the possibility that the medical experts who do believe in it happen to be right. We've seen an enormous amount of parent opinion on this. The burden of taking the wrong course and someone paying the health penalty that might result weighs on us. That's why all of the input we've seen is helpful, but it's not determinate. Opinions are polarized, and we are left with having to design policy that balances all of this, but ultimately emphasizes the safety of our students while trying to keep them in the classroom. I know our decisions tonight won't be agreeable to everybody, but I can guarantee you we will do our best to serve the interests of the children in these school buildings. That's all I had, Kathy.
Thanks, Mr. Doherty.
Oh, and I would ask that my comments be attached to the minutes tonight.
Can you?
I will send them
send that to
electronically.
me And I will get them into the minutes. I saw Ms. Pettit's hand next.
I want to say that I know COVID is real. I am not doubting that it is not real. Some people have suffered dearly from it. Some people have not. However, that brings us back to it's still our choice what we decide to do. I chose last year not to go out, not to do anything, to stay home and protect myself until I was able to get a vaccine because I felt the vaccine was what I needed. My children chose that the vaccine is not what they needed. That's their choice. And I feel strongly that we all deserve to make our choice, especially when it comes to our children. As Mr. Doherty said, we do also need to consider other children, but we're not their parent. We're the parent to our children. And I strongly believe that we need to let it remain that at this time.
Thanks, Michelle.
So, and I just want to thank everybody and for both sides. It's a difficult situation. Everybody has an opinion. But again, we have to do what we think is best for our opinion. Oh, and one last thing, I'm sorry. And it is our job as educators that when these students come in, no matter what their choice is, what their parents' choice is, that we make it acceptable. Whether you have a mask on or don't have a mask on, it is our job as educators to make sure each child is not harassed, made fun of, or and to do our best to make sure that we respect each other's choices.
Thank you. Mrs. Washburn.
Well, I very much respect Michelle's opinion and her voice and the people in here on both sides. The problem I'm having with a lot of the emails and discussion are I believe there are a lot of opinions and a lot of emotions. And I resent the fact that we're even put in this position. I'm a teacher. I'm not a medical professional who's qualified to say, you should wear masks, you shouldn't wear masks, you should get a vaccine, you shouldn't get a vaccine. So, I mean, it's way bigger than Loveland, obviously. I think that this should be coming from other people. So, but with that being said, I just would like to ask some clarifying questions to the team to help understand and make sure that everybody feels good moving forward. So I guess, where's John? About the air filtration system. I know that they've said that that can be highly effective in keeping people safe in the buildings. What's been done over the summer as far as upgrading, cleaning, testing, things of that nature?
So this summer,
I'm sorry, Mr. Ames, we can hear you. You're still muted for the Zoom meeting that's being taped and
How about that?
broadcast. Looks good now.
Okay, good. So this summer we completed a engineering study covering every piece of equipment in the district. Air handlers, pumps, valves, everything. And we have a replacement schedule for every mechanical piece of equipment in the district. The first thing that needed to be done was the air handlers on the roof of the LPS LES wing, and that work was completed. And starting next year, I believe next summer, we will be moving forward with the planned over time, over many years, to replace things as it is needed and bringing it up to speed. I believe we have over $4 million worth of equipment out in the buildings. So it's a long-term replacement. And that's just to give you an idea of what we're doing, what our thoughts are. Obviously, you can't replace all of the equipment at one time. However, we used LJB last summer to analyze everything that we do in the district. All of the air flowing, all of the setups of the classrooms, all of the cleaning, all of the distancing, every piece of work that we did as a school before we moved into the prior summer school, this past school year. During that year, we had very, very few cases of COVID that took place as a result of what LJB recommended to us, how we cleaned the classrooms, how we cleaned the buses, how we filtered the air, how we set the air to turn on 2 hours before the children came in, how we ran it for 2 hours after the children left to make sure that all air in all the classrooms is evacuated and replaced with fresh air. So those protocols that we started with LJB last year are continuing. We have not changed anything. And we feel they were very effective with what took place last year. There was very few changes we're going to make other than replacing equipment in a normal sequence of events as it ages, as it's justified. But the equipment we have and the cleaning protocols that we're using have done a very good job last year. Does that answer?
Yes, thank
Okay.
you. So I think that we discussed this, Mr. Broadwater, when we were walking through touring the summer program. I believe you mentioned it, so I wanted to clarify. If a student is out with COVID or quarantine, since we've invested in the cameras, will those continue to be utilized for at-home learning and live learning for those students?
Correct, yeah. So when we look at grades 5 and up, okay, that have the technology, if the student is out with actual COVID or is quarantined due to COVID, then yes, at grades 5 through 8, we would be able to utilize the cameras and make sure that that student is still being able to participate in the classroom. As we go through the contact tracing, there would be a process in regards to making sure that everything is appropriate and set up for that student, and working with the family to make sure that is correct. For pre-K through 4, a little tougher because they don't have the technology. So normally what would happen is you would have a packet, that teacher would have a packet ready to go for the student that tested positive or is quarantined. That is where I'm at. Ms. Connor, if I missed anything.
Yeah, unfortunately, we experienced the packet last year.
Yeah.
5 through 8 but what about 9?
I'm sorry, 5 through 12.
Okay.
5 through
Just wanted
12,
to
yeah.
clarify.
Sorry, I have a list of questions. So I think it was today, the news story about Lebanon, and I know I've seen several emails to this effect. Is there anything that would prevent us from, so we can help both sides have mask-only classrooms and the other classrooms would be optional?
So we, a couple board members had asked that probably a week or 2 weeks ago. So we dug into it to see if that would be appropriate, simply because it sure makes sense, doesn't it?
Mhm.
The issue that we have here at Loveland, as I dug into it a little bit, our parent request process for our elementary is pretty extensive, simply because we like to be responsive to what our parents would like. And so that scheduling process is about 4 to 6 weeks to do the class placement. So if a family's third grader had Mrs. Jones 2 years ago and they want their student to have Mrs. Jones that's been a long process that I believe everybody in Loveland enjoys and wants to continue. But I think there would be some inherent problems if we did do what you're discussing. The bigger issue, when I talked, and I did talk to the administrators at that level, is we have a lot of specialized learning in those levels. And it would be very difficult for those students that are receiving the specialized learning and specialized programs if we were to try and do that. The last thing I would say with that is when I read through, I believe those students are still together with lunch and recess. So they're not completely separate, if that makes sense when they go through it. So it is my understanding, we did look at it about a week and a half, 2 weeks ago, and the feasibility was just not there. From our elementary administrators on up to us looking at it, it would be a very difficult process.
Okay, I guess I just have concerns, and as does everybody. I know that we've read emails too to the effect saying that people have had all summer to plan. They could have made alternate arrangements, but the numbers have changed and the recommendations have changed. So there are people who would have made other arrangements, knowing then what we know now. I'm just trying to think through alternative options for those potentially that have like medical documentation where they do need to be
So
around
with that,
mask
agreed,
or
very, very valid concerns. We
Yeah.
would certainly meet with each individual parent and each individual family and be responsive and empathetic. I know it's very, very difficult, and see what that means in the classroom. And is there a way that we could work with that family so as to keep that child as safe as possible?
Okay, so people should reach out to you if they have
As
extenuating
we move
circumstances
forward,
and concerns to make arrangements and see what we can come up with.
correct, yes. And as Mr. Doherty had said, there are no 100% guarantees on anything with this, but we certainly will try our hardest and work with our families, as we always do,
Yeah.
to make appropriate accommodations for the concerns they have.
I think I only have one more. Oh, no, two more, sorry. So you talked in your presentation about the distancing and 3 feet when it can be maintained. But as far as contact tracing and quarantining, I think that's a lot on teachers as far as keeping track of distance and who was near one another and such.
Mhm.
So
Well, they've actually made it, they being the Ohio Department of Health, have actually made it a little less stringent because you are going to 3 feet. It was 6 feet, and that would require a lot more. And we were concerned last week at an administrative meeting before those guidelines came out exactly what you're saying. If it's 6 foot, then you've got a lot of contact tracing. And again, I'll go back to urging, if we have students that are vaccinated and masked, then the contact tracing is a little bit easier. But yeah, it's a valid point. And our teachers, we are going to have assigned seating, and they are, the good news is, I guess in all this is we've done this before, right? And so being able
Unfortunately.
to talk to our teachers and making sure that they understand what those quarantine rules are, I think will certainly help.
all right, last question for the moment.
Uh-huh.
And this is more about us and personal liability. I know that it is difficult to take legal action against individual board members, but it can be done if the board members are viewed reckless. And some people would say we're reckless. Both sides could argue that because we're in opposition to published health and medical guidance or violation of constitutional rights, of providing a safe learning environment or of requiring
Sure.
masks.
Sure.
So I don't know that that's something you have an answer to now, but we could potentially reach out to Gary and get an
I will
answer.
tell you, I did, on the urging of some emails, and we read a lot of emails. And basically, when you look at, anybody can sue for anything, right? Anybody can do that. But when you look at kind of the litmus test, it would be, were there mitigation protocols in place? And whether it's mask or not mask, there are mitigation protocol, the bundle. The bundle is there. So there are mitigation protocols in place. If we were masked, would that make it stronger? Yes. But in speaking with Gary, our legal, he believed we would be okay either way, because I asked the same thing, because you could be looking at either way, and what is the exposure to the district.
Oh, sorry. I did come up with one more thing, but it's not really related to masks. I know there have been some questions, and I think this is a good thing about the federal funding for breakfast and lunch. Can you just comment on it quickly?
Yeah, so we put it on our postcard that came out, and on there we said that the federal government is providing funding for the lunch program and the breakfast program. It is not, the one question I had was such that, well, if they're funding, could we use that funding for something else? So no, it's got to be directed towards the food program. So the great news is it's for every child for the lunch and the breakfast programs. And every school district has that throughout the
So
state.
Kids can now come to school and get breakfast, all kids? No, for free?
They were able to last year
Okay.
because of the funding through the COVID relief. They were not.
I
able
knew we
to
got
do
lunch.
that
I
with
didn't
that.
realize breakfast was included.
Yes. Yes. Michelle would have been there for breakfast had she known.
Yeah.
Sorry, Michelle. Are you okay? Are you all right, Eileen? Okay. Dr. Swetchnow.
Thanks, Kathy. I've really enjoyed working with all of you. I have a huge advantage over everybody else on this board because I've lived this life for the past 20 years. And I know very well that science is very rarely settled. And anytime somebody says, well, the science shows this, my mind immediately goes, does it really? You know, what's the real truth here? And masks has been an incredibly controversial prospect. There's clearly positives and negatives out there, and the voices that you listen to influence what your belief is on which one of those are right, which is exactly what we saw in the 150 emails that we received. They're incredibly passionate views on both sides. And it's really hard as a school board member to read those letters and think that I'm the one responsible for deciding this for our whole community. Yet nonetheless, that's the position that we've been put in. And, you know, I very rarely use the word disgust, but I was disgusted by the lack of leadership of our state health department. We recommend that all school boards do this. Well, they're the ones who have the power to do that. They had that power last year and they used it last year. And they've now abdicated that responsibility and enforced it upon the hundreds of different school boards throughout the state of Ohio, which is very unfair to people who don't have the same backgrounds that I have. And it's very unfair to ask in communities that need to heal and grow together to turn each other on thinking that your school board member is going to mandate something for your child. I just find that incredibly unfair. I think that the thing that's really important for everybody to hear going into this is that we're going to see an increase in cases in the next several weeks. Is it 4 weeks? Is it 6 weeks? Is it 3 weeks? It's hard to tell. But if this follows the curve that we've seen, cases will go up, community spread will go up, and children will be exposed and get sick. The quarantine rules that are in place and that we need to enforce are such that if you wear a mask, you won't be sent home. And if you do wear a mask, you will be sent home. I'm sorry, I said that the wrong way. If you don't wear a mask, you will be sent home. And if you do wear a mask, you won't be sent home. I can guarantee you that if I had an unvaccinated child, that in the next few weeks, I'd be sending them to school with a mask on just to avoid them going back home for the next 2 weeks, because my wife and I both work. So keep that in mind as everybody's making decisions. This isn't going to be here forever. Let me say that again, because I disagree with my statement. This current peak isn't going to be here forever. I don't know that COVID's necessarily going to go away, but that's an argument for a different time. I think that Mike has done a great job with the administrative team laying out the thought process and the decision behind the procedures that we'll have. And I think that we're going to do well as a community, and we all need to make sure that we continue to respect each other. And to go back to Michelle's point, the last thing I want to see is kids bullying other kids because some people want to wear masks and some people don't. So just everybody do your best to make sure that my voice, my choice is something that we've taught for a long time in Loveland, and bullying kids because they're different than you isn't okay. That's what I got.
I feel like I should say, since everyone else has been pretty clear about, what they're thinking about this, I think I hold two things to be true. I believe that Mr. Broadwater and his team know and have researched and are putting forth a plan that should be the plan for the district. That doesn't necessarily mean that if I were the only person making the plan, that would be the exact plan that's coming out right now. I agree with Dr. Swetchenow. I have grandchildren. I don't have children in the school district, so I only get to be a grandma and buy the fun mask with the shark face on it. And unfortunately, the shark face mask wore out last year, so I don't have much standing right now. But certainly I would be urging that my grandchildren wear masks when they go to school. I would be urging everyone to wear masks. And my one big concern is that it seems that our district is split 50-50. And I fear that many of those who are advocating for their choice, and I understand that, are advocating for the choice not to wear a mask. They're advocating for the choice to not wear a mask. And so my concern is that we have 50% of the children in the district not wearing masks. And then I don't believe that the Swiss cheese wearing a mask is going to be effective. So that's my worry. But what I would like to ask at this point, as a summary for this board, is to have Mr. Broadwater once again summarize what he has declared the plan to be, and then ask him to also ask the board tell the board what he needs from us if the district needs to pivot from that plan, because I am not sure that everyone has heard exactly what was listed in that video that went out to the district. And so I'll start by summarizing that you're talking about the bundle that we will have with the attempted 3 feet distancing, the continuing of the sanitation protocols, the continuing of watching things so that if we have to go to the health department to follow their quarantine rules, that we know what to do, but that your COVID protocol plan includes strongly urging everyone in the buildings to wear masks, vaccinated or not, but does not indicate that everyone must wear masks in the buildings. And then I'd ask you to go further and clarify, is this going to be an urging for the staff to wear masks, and then a plan to follow the wishes of the parents and uphold, if the parent wants the kindergartner to have a mask on, the district is going to try to make sure that kindergartner keeps the mask on, and to honor the choice of not wearing a mask on the part of students. So if you could just clarify that a little bit, and then clarify for the board what you need from the board, because we clearly right now have a policy that makes face masks the responsibility of the parent or guardian. If there is a need to pivot, if the governor says you need to wear a mask, or if we have at some point spread that makes the district feel like we need to mandate masks for a certain time, what do you need from the board to do that pivot? So I know I asked a lot in there.
I'm gonna try and get
trying
it.
to make clear
I'm gonna try and do it.
what we're talking about,
You
because
bet.
I'm not sure it's clear.
Sure. So a lot in there. And number one, we have been basing all of our decisions on the resolution because that is where we are. And so are we comfortable with the bundle and that we're able to do as much as we did last year? Yes, we believe we'll be able to do what we did last year. Is that enough? I don't know if anybody knows because Delta's different, right? It's different. In terms of dealing with kids, we want to make sure, just like my voice, my choice, we want to make sure our kids have the ability to do what our parents want them to do. And with our staff, we need to work with our staff and see what that means. And with the staff, the thing that comes to my mind is if we say my voice, my choice for our students, as staff members, we're role models. And so we follow the same rules as the kids. So if a parent who doesn't want their student masked has a staff member who feels more comfortable wearing a mask, that staff member has the ability to wear a mask. And so it's so everybody understands that. If we're saying it's important for people to have choice, that's where we are. So moving forward, what I would need, what I have done is we've continued the dashboard, okay? So we are gonna look weekly at our, if not daily, if things pop up, then obviously we're gonna have to look at it daily, but weekly, we are gonna look at where are we with positives or quarantines, where are the numbers? We have a COVID internal team. I'm also going to have, I've talked with our UC health professional, Dr. Brian Graway. I'm hoping I'm saying that correctly. And he is our physician with our athletic teams through UC. Dr. Swetchenow in terms of being on, I'll call it a huddle team. And on Friday, after we put our dashboard together, we're going to take a look at where are we with the district? But I think just as equally important, the doctor had mentioned the 4 to 6 week window. I've seen that many times. And maybe when we look at Hamilton County, where are we? We need to look at all of that data to see where we are. And it may mean that we're going to have to pivot and we're going to have to do different things for our kids. And it may mean for 2 weeks, it may mean for 3 weeks. We don't know. What I do know is, again, I'm looking at it from the educational side. I'm not a medical expert. Educationally, I have my own children. I've got 5 children. If my child is vaccinated, I'm pretty sure they're not going to have to quarantine. I don't have to take off work. I get my child in the building. If they wear a mask, if they can't be vaccinated, then I know my child is going to be able to go to school. So when I look at it educationally, strictly, that's what I would look at as a parent. And I know Eric had mentioned that. What I would need moving forward is the ability to pivot. I have not gone through our policies in the week or so I've been here, but I believe we'd have to have some sort of, I don't know if it'd be a resolution, some sort of ability for the superintendent to pivot if needed so that we can continue to be receptive. Maybe, and I had mentioned on the one slide, maybe it's pre-K through 6 that we have to take a look at because the vaccines are working at the grade level that we think 7 through 12. Again, this is all conjecture. I'm not a medical expert. I'm worried about kids. I don't lay my head down on the pillow easily these days because I worry about kids. And that's where we are. And our community needs to take care of each other. But I believe I would need the ability to pivot if needed.
It's my understanding of the policy process that there is currently a policy in effect that says face coverings are the choice of the parent or the guardian. It also says that if there are directing entities that require masks, then we will follow that. So if a directive came from a health department, a state official, a federal official, if, for example, we're following the federal mandate to wear masks on buses.
Right.
So if a directive came down, then you obviously, the district has the ability to pivot immediately with that. The need would come if there was a decision on the part of the district that mask choice was something that needed to be changed. There would need to be an announced board meeting. It could be an emergency meeting, which could take place within 24 hours,
Sure.
or not within 24 hours. We need 24 hours of notice, but there would need to be a board meeting to make a policy change. That can be done according to our policy on policies, which I love to reference, which says that we do not have to have a first and a second reading. So we don't have to have 2 meetings, but there would have to
Sure.
be a board meeting to change what I believe is the current COVID protocol directive that you have announced and are announcing and are espousing for the district. There would have to be a meeting if there's a change to that.
Emergency meeting, would you be able to do that by Zoom or? It
No,
has to be in
we
person, so
can't
that
meet by
was all
Zoom.
totally
No,
gone,
that's
right?
done. We're done with Zoom. I mean, we're not done with Zoom. We're using Zoom to stream or to broadcast the meeting. The board members would have to be present. So at least 3 board members would have to be able to make the meeting, but all board members would have to be notified that there was a meeting.
And the public.
So-
And the public,
okay,
yes.
Just out of, this is just kind of, so if we had an in-person meeting, an emergency meeting, there was 3 board members, can the other 2 join by Zoom to give their opinion?
Not
vote,
according to,
not
not
vote.
according to the legal advice that I've gotten, that board members can no longer participate in a meeting via Zoom.
Okay.
And so giving opinion would be not possible. So the best thing would be to have a meeting where everyone could come.
So they,
We're all hoping that we don't have to have that meeting.
yeah, so an absent board member would take on kind of the status of a member of the public being able to watch the meeting,
Yes.
but in this case, not contribute to it.
Yes.
So if you want to have a say in the process, and God forbid we have to have an emergency meeting to do this, you got to show up. And I
if
would-
If only 3 board members were able to be present, 3 board members have to, I believe, agree. Yeah.
So it needs to be unanimous if there's only 3. Yeah. So I think this makes sense. I think all of us have struggled with what's the right answer. And I'm just loath to dictate to the community what to do without the community kind of doing reasonable, logical things really on their own. There's a degree of uncertainty here about how quickly this thing arrives and how intense it is when it does arrive. So, being a logical part of me says the smart thing to do for everybody is to get vaccinated if you can get vaccinated. And for sure, wear the mask at least for a few weeks and see what's going on. But telling people to do that, I learned in decades of business, it was far smarter to convince people what to do than to tell them what to do. And I think that
You didn't learn that with childbearing?
all of those years of practice for dealing with tens of thousands of employees. So, I just find that that's far more effective. People do it because they have figured it out. They processed all the information, and they do it voluntarily because they've come to the conclusion that it makes sense. And to me, that's a much more positive approach to this. The downside, of course, is that, we get blindsided by a rapid emergence of Delta in the buildings. Go ahead.
Just to interject, every Friday, Greg Kesterman from Hamilton County Public Health is with us as superintendents. We meet, and I'll have my leadership team there so that they can hear the same thing when he is talking. If I hear from him that there's a strong urging that our hospitals are filling, that ICUs are filling, whatever the information may be, this isn't about just looking at our particular data. It's looking at where are we in the community, but also what are the public health officials saying? And to Eric's point, it would be a lot better if they were the ones mandating if they see that something is going awry. But I just want to make sure we're clear. It's not just our kids, but it's all information. Having medical expert, I'm not a medical expert, but having medical experts looking at it. And I know our community I have been in it long enough to know that we're going to take care of each other. And if we see it's a true danger for our kids, we need to adapt and we need to adjust.
Mike, I asked you earlier today, and I don't know if you've gotten an answer on it, to see if there are any early opening districts that, aside from the 2 in Indiana that I mentioned, might give us an early warning on this.
We had talked about that. I had not found anybody in the state of Ohio. I may be wrong, but I have not seen anybody who started as of yet.
So anybody starting ahead of us, what are we on the 16th or
18th.
18th, sorry. Anybody opening before us? Doesn't sound like it. It's Friday.
Yeah.
So Mason would be a week ahead of us or so.
Few days.
Okay, so, sorry. And any feedback on those, or can we get
Now,
feedback on
I
those?
really have looked at the state of Ohio because of the quarantine rules through the Ohio Department of Health. Sometimes you're not comparing apples to apples when you're looking at that, but
Right.
I
All right,
had,
so, I mean, where I would be on this is, I think, for example, we ought to heed your request and facilitate kind of a rapid gathering of the board if you saw the need for us to get together quickly. And that might mean that we take a look at calendars and make sure that we have a date penciled in that we could react to quickly, but only if you felt that there were indications that would warrant a reexamination of the policy that we've got. Could we, would that be agreeable to the board?
My personal feeling is it's pretty difficult to determine when this might happen. And so then to determine dates, I mean, it's not going to happen. School's going to start the 18th. It's probably not going to happen by that Friday. So we probably don't need a date next week.
Well, the two Indiana
Following week,
schools
we
maybe.
have a meeting.
Mhm.
So my personal feeling is to give it that time. And then if we need to, on the 31st, start talking about, you know, here's where we see things are going in different school districts. Here's where we see things are going. Can you pencil in maybe every Tuesday for the next
Yeah.
7 years?
So you know, the only thing I would say to that is that and these are just the two references I have so far. And if those are the only two that happened during the course of the year, amen, this is done. We don't have to worry about it. But there were two that got blindsided in their first week of opening. And if that happened here, where, you know, we're on the verge of having to, I mean, the rates that they have, I think by my estimation, puts 400 kids in quarantine for us. 400 kids, potentially. I'm sorry, I can't do this. 400 kids potentially in quarantine.
well,
And I don't know what level you get to before you have to say, I can't run the district.
that's a
we're
very good
running.
point.
So
Yeah.
I just want to be available to, you know, examine the situation and to make a call if a call needs to be made as responsively as possible.
And it's a good point that you brought up. It's not necessarily, again, as an educational expert, not a medical expert. I want my kids in school. I want our kids in school. So we're not just looking at positives. We're looking at if the quarantine is getting to where we've got a whole classroom that we have to, now we've got different discussions because I will have medical experts and I'm going to look at, do we have kids in the building? I need our students there, our teachers are excited to come back and they've got just as many reservations as families do. And we need to be respectful to everybody in this decision. But I just want to make sure that it's not just about positives, but it's the whole picture, the quarantine, everything we'll take a look at.
And let me just chime in and make sure that I understand the quarantine rules that we're facing, which is if children are wearing masks and they're unvaccinated and they're a close contact, they're not going to be asked to leave school.
As long as they're outside the 3 foot for the 15 minutes over that amount of time.
So we have a lot of control, or parents and children have a lot of control about quarantine exposure here.
Exactly.
And my assumption is pretty obvious. When people look and say, oh, this is bad, I don't want my children home for the next 2 weeks. If there's significant community spread, children will be wearing masks all the time.
Well, if I read our data last year correctly, our kids paid a price for not being in school. Statistically, less of a price than a lot of other districts around the country, but nevertheless, they paid a price. So keeping them in the classroom I think, Andrew, you would agree with this, I'm sure, is kind of a critical objective that we have.
Again, just statistically, it looks like the first 2 or 3 weeks of school will be the most challenging.
From this Delta perspective, you're saying?
So we'll find out. If I was a fortune teller, I'd be better than.
So I guess I would ask the board if they're interested in what Mr. Doherty is talking about. Would you like to say whether or not you are available either the 23rd or the 24th? School starts on the 18th. If he knows that you're available on the 23rd or the 24th, not announcing a meeting, but letting him know that, then we have a meeting the following week. And at that point, we could look at it, because I just know how long it takes to look at people's calendars. And
For something that's important, I'll be available for whatever day.
And yes, and it doesn't have to be evening. I understand that's difficult for you. Well, we may have to go to,
Right. I think it's pretty clear for all of us that if we're in town and you give us 24 hours notice, we can make a time.
That may be the best way of doing it, just all making a commitment that if
So
Mike
nobody's
calls,
leaving town.
we're going to show up.
Ever.
no, nobody's leaving town, so we get this all.
I
Like a
will,
police officer. Now, don't leave town.
that's a lot of power.
Quarantine Florida, please. Just kidding, I'm leaving town.
If there is truly a situation where we really need to have the students out of the building, we do have the calamity where, we can do something quickly in that regard, but in terms of masking and so forth, that's.
So if it's okay with everybody, we could just leave it with, we've all committed. If Mike says, I need to see you, we can all show up pretty much within, what's the requirement, 24 hours?
24 hours. Has to
Within
be
24 hours.
All right.
Very good.
All right. Anything else that we need to discuss about the COVID protocols? I was going to ask him, make sure the quarantine chart is in your report. Can that be placed somewhere very visible or very easily accessible on the website so that people do know what the quarantine
Yes,
chart is?
sure I'm not muted. I spoke with Andrew, our communications individual. We are looking at making a Loveland specific based on our policies, so we can make it a little bit easier to read, and we'll have that up on the website.
And Mike, there's just something, it's been brought up, but you brought it up, and I think maybe Eileen brought it up as well, but we all got emails from parents that were very, very tough to read with respect to kids that are medically fragile or other issues that are going on. And it's one of the things that I've learned the public schools have an obligation to do, which is to, take all comers and to deal with all issues. Are you comfortable that we can kind of wrap ourselves around, the families that have these very unique, very difficult problems, and we can find some way through it with our existing protocols?
To say I'm comfortable with anything probably would be a misnomer, but do I know that our administrators are extremely empathetic and our teaching staff is very adept and very compassionate? I do. Do I believe we will do everything in our power to do as much as we can for those kids? I do. I do know that we owe these parents conversations and being accessible to them, because we're parents and we worry about our kids, and that's our number one priority. And I know there is a lot of emotion, rightly so. And so when there are those concerns, there are no guarantees with any of this. The Delta, we just don't understand. There's no guarantees, but we will do everything in our power to work with these families.
And one other aspect of it, I think you're going to be with the teachers sometime soon?
Monday. Mhm.
Monday, perfect opportunity, right? I think it's a perfect opportunity to share with them considerable feedback that we've gotten, and Michelle and Eric brought this up earlier about, I don't know how to describe it. Let's just say the insensitivity of some kids to other kids, or
Sure.
et cetera, right, around this issue. And maybe it's a good opportunity to bring that to the surface in those discussions, because they're the literal adult in the room
Absolutely.
that can help mitigate those
Sure.
issues to some extent.
Absolutely. And if I know you and Ms. Washburn, we went around summer school.
Mhm.
If summer school is any indication, the kids were awesome. They
Right.
did a very good job.
Right.
But yeah, we can do that. We can make sure and the
For those-
staff's aware of it.
For those folks that haven't had a chance to see that, and thank you, Eileen, thank you, Mike, for giving me the opportunity to walk through those. It was really kind of cool. They weren't dense classrooms. There might have been, what would you say, 10 kids in a class?
About average 12, probably.
So a dozen kids in a class. So they weren't dense by our normal standards. And there was a sprinkling of kids, I think, in every classroom that were wearing masks. Everybody was just dealing with it like it didn't exist. So if we could have that situation where masks and the masked and the unmasked are coexisting compassionately with each other,
6 feet apart.
that's a win. That's a win. And again, the teachers maybe can help deal with that concern.
It's another opportunity. It's another teaching opportunity on how to treat each other, how to be respectful. And I have all the confidence in the world with our teaching staff. I know they're very compassionate. And I know when we get into the buildings and we start teaching and taking care of kids, we'll be ready to go. But to your point, yes, letting our staff know it's different, right? It's different. So
Right.
letting them know.
So last thing I'm going to say on this, and I'm done. I appreciate you bearing with me through all this stuff, but you know me, this is who I am, right? I don't know that the email traffic, this is the data guy in me, and you're going to hear this all year long. I don't know that the email traffic is statistically representative of our parents. There's just no way to say that. And I always want to understand where everybody is at versus the folks that decide to let us know where they're at. But if it is representative, there's a whole lot of folks who will hear this discussion tonight and be disturbed that we didn't change anything overtly, right? And I think we have to make the district an understanding and safe place in their minds as well. That may be a new challenge for us to try to figure out how to say, I know you're concerned, but we are watching this so closely that we kind of got a hair trigger. If something starts to go off track, that we can look at it and react appropriately to it. So I think it's something to think about in parent communications going forward.
Right. And we could be having this discussion this evening and everything changed tomorrow. That's just the way this has been throughout the last year and a half or 2 years. And so every day we'll be diligent about looking at it.
That's the issue about how things change. But I was going to follow up with, I assume that this is already a part of your plan, but because there was this meeting and because there is an understanding that there was a conversation this evening, not everyone listens to our meetings. Not everyone emailed us. And so I believe, and I assume that you believe, that a further communication is needed for all of the parents in the district. And in my mind, it needs to be a very short, very clear communication that this is the COVID protocol today, and this is the process if it were to change. Your video was great, but what your video did was engender a lot of conversation.
Sure.
The response that we want you to keep it that way, or the response that no, please change it. And so I think it needs to be really clear, not what we discussed tonight. You don't have to recap what we discussed, but just a really clear, this is what we're doing so that everybody
Yeah,
understands,
we had,
whether they listen to our meeting or not.
sure, we had discussed tomorrow, the building principals would be sending out the district would be sending out the different building protocols. So my thought was to attach a short video with that so that all of our parents are aware, and then they can look at the mitigation protocols with that. Also, I've got to get it out to our staff. You know, we need to let our staff know and be prepared as we move forward. And just we're gonna look every day, and we may have to adapt every day, but we need kids in school.
So can I make a closing comment on it too? And this isn't to stir things up, but when Kevin asked you if you were comfortable, you were like, to say I'm comfortable. So as a parent, so I'm sure there are other parents out there that are feeling this way, that makes me a little nervous. I would just challenge you and the administrative team to revisit the masked classrooms, or the idea of having one team that's virtual that potentially happens with medical documentation, or to, I'm just talking out loud. I haven't thought this one through yet. So talk through, get a team of teachers together to see in the classroom, does it make sense when you do your seating chart to have a masked half and an unmasked half? How will that affect the kids? Will it affect the kids? Maybe staggered release times from class. So just some ideas and things to discuss with the team.
I think what we'll find, yeah, thank you. I think what we'll find is after this meeting, with the direction that we have, our administrators getting the protocols out, and then as the kids are coming in and working with them, I know our staff will do a great job of looking and see, you know, what can we do to help the kids. When I say I'm not comfortable, I say I'm not comfortable with offering medical advice. I am comfortable as much as I possibly can. I know we will do everything we can in our power to keep our kids safe. There are just unknowns in the medical field that I'm not an expert of.
I just want to say thank you for coming to work for Loveland and having such a great, easy start to your work here in the
Well,
district.
It's a great community. I expect great things of it, and I don't take any of this lightly.
We appreciate that. All right, everything all right? We then move on to, if you're looking at our agenda, administrator reports, all that we have under there is the business manager report. That was for board member information. And then we will move on to the 4 items. I believe there are 4 items that are under the resolutions concerning sort of business manager items. And so, Mr. Doherty.
Yeah, Kathy, if I might, just for the benefit of our audience, if you haven't seen the agenda, from this point forward, we have a few kind of business items to take care of. And then we're going to go into executive session on a personnel matter, and then we'll end the meeting after that. So if you were only interested in the mask discussion, I think we can say that's completed, right? Right. But you're welcome to stay until we go into executive session, and then it's up to you, okay?
It's all right. I won't make some snappy remark like unless we all get COVID before no, that's too soon, right? Okay, so the first item we would need a resolution to approve the purchase and installation of a mobile classroom unit.
So moved.
Mr. Doherty moved. Is there a second?
Second.
Dr. Swetchenow seconded. It is a motion to approve the purchase and installation of one 24x40 mobile classroom unit from EMOD Construction for the Loveland Primary School to be used as a music classroom. And the amount is $181,202.
This was the one that was presented last month, correct?
Yes.
And as I recall, there were 2 possible presented, and this is one of those. Is it the same price?
Yes, it is.
Okay.
We decided just to go with the one for the music classroom, and we're holding off on the other trailer until we finish with our renovations, just to confirm that the facility and the area is needed.
Could I ask somebody to get that door for us? Thank you. Thank you very much. Okay, any questions or discussion? Treasurer Pro Tem, you get to call the roll.
Roll
Wait, I'm
call.
sorry, there's, I was
sorry.
just, John, I know, oh, sorry.
That's
The,
okay.
John, I know that you had just said that compared to the previous one, that there's no changes. I was just looking back at the June 29th presentation. It looked like EMOD music 24/40 was going to be a total cost of 165,627. Is that not the one we ended up with?
No.
That's the 24/60.
Can you
Again,
bear?
I'm just looking back at June 29th.
Or
Yes.
24/40 here.
Is it EMOD?
It is EMOD.
And it just, the note on June 29th would actually references information from the 583 report. And it says total cost of 165,627.
Can you bear with me just a moment?
Pardon? What names would you like to use?
We should have nominated someone else.
I am-
Clearly, we needed a different treasurer pro tem.
I see what you're talking about, and I cannot at this moment confirm to you. I would be glad to pull it and bring it back on the 30th. All I'm doing with this one, it has already been, the order's been placed, and it is, the work is being done so that it's ready for, or hopefully ready for school to start. So if you would like, I can bring it back to you on the 30th, 31st.
You can install it without us approving
Oh,
it?
yes, I've already
Because we-
done. This is
because
just
of last
to
meeting.
memorialize what has been done for the next generation of people here, so they don't wonder how I ordered it without board approval.
So we need it for the first day of school, or we're gonna have kids doing music in the parking lot.
So I apologize for the discrepancy, and
I think we do need to approve the purchase amount because it's a
yes,
the
very definitely.
amount. But you're saying that it can wait
Yes,
for the 31st.
yes,
All
not a
right.
problem at all. I apologize.
John, just so you didn't open a can of worms just now, what did we do earlier on this? Remind me. Did we approve?
The
Going ahead
board
with this?
Granted verbal approval to move forward so that we could get things going. And the question was, were we going to go with the 24/40 or the 24/50? And what I may have given you at that point in time was the 24/50 price, but I'm going to have to, I just need to confirm it. But you had granted me the authority to go ahead and get it going verbally. But again, I just want to make sure that there is a vote for the board for the future. So this is
So
not
the
going
action
to,
that you've taken has been approved by the board. This is a more specific element of what we approved earlier.
that is correct.
We approved verbally. We did not
Verbally.
have a resolution. We
Right.
gave the nod to go ahead, but we need a vote of resolution in order for the treasurer to be able to pay for this when the time comes.
Yes,
So we need to have the correct amount
yes,
so that it goes with the contract.
yes,
So
Very
I'm
good.
going to make a motion to table this motion.
that's
Is there
fine.
a second?
Second.
Okay. And so we would table this and we can bring it back to the table on the 31st.
Perfect.
All right.
You're comfortable with that, John?
Oh, yes, no problem at all. I apologize.
Oh, and actually,
Do we
I
need to?
I have to say, I apologize. I was out of town last week and I've been on call this week, so I didn't really get a chance to look through it very carefully. I would have asked you otherwise earlier.
Don't worry.
We need to vote on the motion to table. So,
Yes.
so now, Eileen, we're going to vote.
All right, so we are voting on the motion to table.
Yes.
Dr. Schwarzenau,
Yes.
Mrs. Washburn, yes. Mr. Doherty,
I'm going to vote the same as Dr. Eric. And yes,
you got to say Dr. Eric, Dr. Lorenz,
Yes.
and Miss Pettit.
Yes.
Motion is tabled. and it's switching now. It is daunting. I understand that. Okay, next motion, we need a resolution to approve the purchase of 3 2021 model year school buses from bus bids received from the Southwestern Ohio Educational Purchasing Council.
I move.
Ms. Pettit moved. Is there a second?
Second.
I was going to say, oh, nobody wants to buy school buses. And those buses are listed there, a 48 passenger special needs bus with air conditioning, 100,960, and 2 77 passenger school buses. And I presume that's 90,721 each.
Yes.
We don't get a 2-for-1
No bargains.
price. Okay. Any discussion or questions on that? All right.
I would just say, in the facilities committee, you've explained the reasoning for an air-conditioned bus, and it relates to special student needs. And for anybody that's looking, why are we doing this? There are some special circumstances that warrant this.
Thanks. Any other discussion? All right.
All
Mrs.
right.
Washburn, can we vote?
Roll. I vote yes. Mr. Doherty,
Yes.
Dr. Lorenz.
Yes.
Ms. Pettit,
Yes.
Dr. Schwitzener.
Yeah.
Good, yes.
Motion, say it really fast.
Yes,
That's right.
motion carried. The next item is a motion to approve a change order in the amount of $5,100 for Duraseal for seal coating. And I'll make that motion.
I'll second.
Mrs. Washburn seconded. Questions on that? That was also in Mr. Ames's report
What did
concerning,
we Duraseal? I forgot.
Sorry.
What did we Duraseal?
The not Tiger Trail, the driveway going up to the football
to the
field
Stadium.
and all of the branches and the going up to the baseball field, to the softball field, and inside the fence area. That,
Pause.
yes, the new paws are already there.
so that was additional to what had been, and
Yes.
that's the reason there's a change order.
Yes.
Okay, 'cause everything does look very nice. We did lots of paving and lining and changing over the.
It does
summer.
look nice.
Thank you. All right, any other questions or discussion? Mrs. Washburn, can we vote on that?
Yes, Mr. Doherty,
Yes.
Dr. Lorenz.
Yes.
Ms. Pettit,
Yes.
Yes.
Dr. Schwitzener. And I vote yes.
All right. And the final under business manager items that we have this evening is we would need a motion to approve a contract with Robert Half and Associates to provide temporary technology support.
So moved.
Mr. Doherty moved. Is there a second?
I will.
Okay, and that also was outlined in Mr. Ames' report, which appears on board docs. Questions or discussion about that?
This is not necessarily a John question related to this, but it just had me thinking earlier when I read it. And I can't, do we still have the student tech desk
Yes.
support?
Yes, they during the school year, each period, there is a group, mostly at the high school, and there are some at the middle school that do work with our students or that
Okay.
work with the tech people.
Great, thanks.
John, if I read your report correctly, this is we're using an outside service because you have too much turnover, because we essentially are a stepping stone. Somebody comes in, gets some experience, and then leaves us. That's been the history. So this is a more efficient way of staffing the position, number one. And my other question is number two. You used to use Forward Edge for this. They can't do it anymore, apparently. Are we going to be paying more or less with Robert Half?
Okay, so first of all, you asked, we transitioned from in-house staffing maybe 6 or 7 years ago. We still have one in-house person doing the technology support. But at that time, we opted to staff it from temporary services, Forward Edge, and they are having a terrible time trying to recruit people also, just like everything else. I am not currently employing somebody via Robert Half. We are just looking at them. If we can find the right person, we've already looked at 2 resumes and opted not to go with those. So we're trying to find the right fit, whether it is Forward Edge, whether it is Robert Half, but I just need the ability when we find a person that can do the job to bring them in on short notice. Right now we are down, I believe, 1, maybe 2 people trying to start the school year, which is kind of a nebulous thing trying to get it going.
So do I infer that the cost is
Oh.
the market cost or what?
Yes, it's virtually the same cost.
Virtually the same.
Now
cost.
this, for Robert Half, it's $45 an hour, which is different than what we've been doing with Forward Edge. We do a contracted a year with a person, but that is going to have to change since people are leaving and they're not able to backfill. So we're going to have to change that model to an hourly rate also, just to deal with the transient nature of these young people that are using us for a stepping stone. And I understand what they're doing. They're smart young children, young kids, and they get some experience with us, and then they can go out and do something different.
And if we need to make a change with Forward Edge and do an hourly, will that require a board resolution to change the terms of that
I
agreement?
don't have an answer for you. I'll find
Okay,
out.
that I would just
Right.
ask if that has to change.
Yeah.
Hi.
And I think that this should probably be obvious, but is our contract with Forward Edge such that if they are not able to provide the personnel that they had initially intended to provide, that we're paying them less than we had agreed to pay initially?
That is correct. Yes.
Anything else? All right, Mrs. Washburn, can we vote on that?
Yes, Dr. Lorenz.
Yes.
Ms. Pettit,
Yes.
Dr. Schwitzenau.
Yes.
I vote yes. Mr. Doherty.
Yes.
I'm going to try to say it different every time.
That's a good plan. Motion carried. All right, the next item on the agenda, and I will just, in the absence of a treasurer, this is a very simple required resolution that we need. It is the resolution to request the county auditors to make advance payment of taxes pursuant to ORC 321.34. It is because there needs to be a request from the treasurer that the auditor pay us the taxes that we are owed. I have never understood why that is the case, but that is a requirement that the board must make the request for the advance payment of taxes. And certainly we do want to receive the taxes for which we are owed. So that's what this resolution is. So I will move to approve the resolution requesting the county auditors, and it's all the county auditors, to make advance payment of taxes.
I second.
I
Okay,
heard you both at the same time, so
Eileen can have it.
I'll put Dr. Washburn. I've elevated her.
Ooh.
Dr. Washburn to second on that. Anybody have any
Can
questions?
she say that name?
She can say Dr. Washburn.
My question is, when did I get my doctorate?
I just poof, you have a doctorate. So any questions or discussion on tax advances? All right, then can we vote on that?
Ms. Pettit,
Yes.
Dr. Schwitzenau.
Yes.
I vote yes. Mr. Doherty.
Yes.
Dr. Lorenz.
Yes, motion carried. I am going to move that we make Mrs. Washburn our roll caller permanent so that we can see how many different ways she can say Dr. Swetchnow.
I don't want to tell you how many years I've known him too. Oh,
All right. We then move on to the Director of Human Resources items. And the first one is resignations and employment of certified classified homebound substitute and supplemental positions for the 2021-2022 school year. Is there a motion?
I'll move.
Second.
Mrs. Washburn moved, Dr. Swetchnow seconded. Questions or discussion? You have on board docs a list of human resources items. It is rather extensive for this time of year. We did receive a report from Mr. Carter. Do you have anything that you would like to add? And then we'll see if there are board questions.
Yes, absolutely. This being my first time to be able to be at this board meeting in my new position, I want to thank you for the opportunity, and I'm pleased and eager to try to do a really great job for the district in this role. So I appreciate it. Yes, as you can see that since our last board meeting, which would have been in June, we have had a lot of activity over the summer. It's been a very busy summer. And there are a couple of things, and these things are in my report, but I just wanted to make sure that you guys realize a couple of things. Some of the recently added spots are highlighted in yellow, so you guys can know that those were just recently added. It might look strange that there are so many folks who are in this first section in section A in the retirement, resignation, leave of absence section. We do have some certified staff members that are working at different places or are no longer working in education anymore. However, I do want to point out that there are several pieces in here of folks that have been on board minutes before. An example of this is that we had a couple of paraprofessionals that we hired for this next school year. They were on board minutes earlier. They then had other positions that they accepted. So we just have to have their resignation here. And we have then since filled those positions. So those are some folks that hadn't even started with us. There is also 4 positions that are in here that you will notice that were for marching band and color guard in that section. And those folks were on the board minutes because those were the folks who we had planned on using again. They were the people that had done it from the year before. They no longer wanted to do that. So those 4 folks are resignations as well. So it might look rather lengthy. A, it's summertime. B, we haven't had a meeting in a while, but also there are some other pieces to there that kind of explain the long list of those. Something else I'd like to point out to the group, we just had actually today, we, just so you know, for the start of school, we hired 2 teachers today, and they're on the board minutes. So those 2 teachers for the Loveland Primary School, a first grade teacher and a second grade teacher. So teaching staff wise, we are a go. I am double crossing my fingers that there is nothing that happens between now and the start of school with certified staff members, but you never know. But it was really nice to be able to meet these 2 individuals today. There are some other pieces I want to make sure that are on here that are also in yellow because they are new. We had 2 positions that were supplemental positions, and they're at the high school in the athletics category. We had anticipated having a JVB boys soccer team and a JVB girls soccer team. Neither the boys nor the girls, there weren't enough students or athletes to fulfill those teams. So I just want to be clear that those 2 supplementals are not going to be filled. So it's not as if we're paying out those supplementals, even though we're not having that team this year. Those particular 2 folks are still staying on with us, one in a volunteer fashion, which is an unpaid position, and the other one is moving to a co-split of another one of our teams, the JV team. But the JVB, boys and girls, those aren't happening. I wanted to make sure to make that note so you guys are clear on that. There is something else that I wanted to make sure to let you guys know about. We had here on this campus, we had a custodian who resigned, and we were able to promote a second shift custodian from LECC to be able to fill that role here. In addition to that, we had a secretary that's on the resignation list. She was able to get a job where she lives and where her kids go to school. And we were able to find a secretary for the middle school in the 10-month position who actually has some experience working at Final Forms as well. So we're really excited to bring her on as well. So just a little bit of an update there. And there is another piece that's in here at the very bottom that was added. And there was lots of discussion tonight about the Delta variant and COVID-19. We, on an hourly basis, we're having some assistance from somebody named Kevin Leamy. We are, quote, retaining him again. That's a per hour basis. We, of course, are hoping that that is going to be needed at a minimum, but we are unsure on what's going to be happening, even though with all of our our plans in place. So he's on the board minutes here at his per rate hour. It's not to exceed 40 hours a week. And we are not anticipating him needing to work 40 hours a week. Last year, that wasn't the case. Just wanted to make sure to bring that to your attention because it was a late ad. Okay. Questions about this
If I
particular
can-
piece?
Can I ask a couple quick questions? If
Absolutely.
Just while I'm thinking, because I'll forget them if I don't. Just to be clear, the reason there was not a JVB and the JVB teams was simply not enough students to do that.
That's correct. Not enough student athletes to field a full team.
And then on the all of the additions that were or not additions, the resignations and the additions of staff, I'm assuming that we are not above. We haven't added any positions that were not positions that needed to be filled.
That's
And
correct.
you mentioned that for the certified staff, you think we're good. You should never say that because something will happen.
Yeah,
You
knock
think
on
we're
wood.
good there. Are we also good with the aids and the activity monitors? There were several of those. Do you think we
Yes.
are at the point of having that completed?
Yes, today, actually, we just heard word that we got a recommendation, but it was way too late to put it on the board minutes for some folks here at LIS for an aid position. And then there's another one that's a shared position between LIS and LMS. We got that recommendation late. It'll be on the August 31st meeting. We're meeting with those folks tomorrow. And
Garth, I'm sorry, can I
Yes.
interrupt you? Just, I think our video broadcast stopped.
Oh.
John, can you double check if we're still broadcasting? It went off over here and I got a note from somebody. You're watching it.
It does
As
say
if
we're
from the
recording,
outside, right?
so-
Okay.
clear, like me to continue?
Yeah.
Okay. So I think I answered your first question, which was, are we settled yet? We activity monitor wise and aid wise, we are good. There is one extra piece that we still have to meet with those folks. We got their recommendation today. I think another part of your question was, is there additional staffing that's being added? And the answer to that is no.
Right.
There isn't any additional staffing that has happened that we didn't anticipate from when our board meeting in June. So all of the hires that you're seeing, it's because either A, we hadn't hired someone yet, or B, it's because we had a resignation and we're filling that spot. Another piece to add, you'll see in the resignation notes, there was a 0.5 part-time paraprofessional aide. That was at the LPS, LES building. We worked with the building administrators and we are not replacing that position and covering that with already hired staff. So we're actually a little bit below what we were anticipating by just a half position in the aid category. I appreciate the questions. Anybody
and
else?
I will just note that at some point, I would love it if we have a report on what is happening at kindergarten, because I think that that's something that was in flux last year, and it would be great for us to hear how that is full. And so that's partially a human resources, but it's also partially a curriculum. I'm not asking for any, I mean, who knows what's going to happen next Wednesday in kindergarten, but I would love to hear how
Yeah.
the kindergarten is starting out this year.
I don't have we can get that information for you. I do have a bit of information that there was an FTE that was at the high school level that we hadn't replaced due to COVID. And we kind of shifted the thinking of needing that full-time person instead of being at the high school and filling the spot that we needed to add additional staffing at LECC because of the switch for kindergarten. So I know what you're getting at.
So now they're having AP Physics at kindergarten. Is that what you're telling me? That-
No, not quite.
Okay. all right.
Actually, I'll tell you the truth,
Thank you.
man.
I didn't mean
since
to derail that at all.
Yeah.
I just wanted to get that
Uh,
sort of registered.
Our
Thank you.
kids are bright, but I don't think it's AP
That's
Physics
right.
in kindergarten.
I know Mr. Doherty had questions and I
Yes,
asked
Mr.
mine
Doherty.
first, so thank you.
You asked my question. I'm fine.
Oh,
Great, thank you.
wow.
My same old question. How are we doing with head count? And Kathy's learned, so
I thought
we're
your
good to go.
question was going to be about AP Physics in kindergarten. I appreciated on your report that you included the savings to the district. I don't recall seeing that in the past, but with resignations and then hiring some new teachers, there was a savings there. And then secondly, this is minor, just so Kathy will be happy. There is a typo under supplemental position C. You have Derek Caney spelled two different ways. So just a correction to make there, right?
If Mr. Ogden, the outgoing HR director, is listening, I know he's thinking, ha, you messed up the first one, have a typo. We can make sure to get that fixed. Thanks for pointing it out.
Thanks, Eileen.
Garth, I have one question to add regarding H, the contracted services. Did Kevin do that job for us last year?
Excuse me, can you say that again?
Right. Regarding contact tracing.
Yeah.
Is this the same person that did it for us last year?
Yes, it's the same person as we had last year. That's correct.
And if I recall correctly, although we probably need Kevin Hawley to answer this question, is that being funded through our COVID funds? Do we?
Yes, it was.
So not an additional headcount person.
That's correct.
Great.
All right, anything else? All right, then can we vote on the HR?
Yes, Dr. Schwitzenau.
Yes.
I vote yes. Mr. Doherty.
Yes.
Dr. Lorenz.
Yes.
Ms. Pettit.
Yes. Oh, sorry. Yes. I was going to say motion carried. Sorry, I jumped.
She
the gun
voted
there.
for you.
I did not vote for her. I apologize. All yes is what I was going to say. I was sure you were okay with it. Sorry about that. Ms. Pettit voted yes, and I jumped on her lines. All right, the next item is a motion to accept the negotiated agreement with Loveland OPSI Local number 363. I need a motion to that effect.
Second.
Okay, so Mrs. Washburn moved and Dr. Swetchenow seconded. That is to approve a collective bargaining agreement and to further authorize in conjunction with OPSI, making grammatical and non-substantive revisions as approved by legal counsel. Any questions or discussion? Mr. Crowley.
Yes, I would like, before there's any questions, I would like to go over just some brief couple of things. They're in the report that I issued to you guys, but I want to make sure we're on the same page with this. The first thing I wanted to add is that originally on board docs, the motion that you just read, Dr. Lorenz, didn't include the words in conjunction with OPSI. And I wanted you to know that after talking with them and working with them, the intention is always that we would be doing that in conjunction. We wanted to make sure that was a formal process, that if we find typos or anything that is not something that would really need board approval, that we will do it, but we obviously will be doing it in conjunction with them. So wanted to make that clear. And then some of the pieces that are inside the OPSI contract that I want to draw your attention to. And the first thing I want to talk about is the compensation piece. And first I want to thank Mrs. Pettit for her being with our group and working with us when working with our OPSI leadership through this. I really appreciate it, Michelle. A couple of things that I want you guys to know is that as a district, when we make decisions about compensation with folks, we don't take those decisions very lightly. And we want to make sure that we are doing what is right for A, our people, and B, for our region to stay competitive. And I want you to know that during our negotiations with the group, that you will notice that there are different amounts of increase per classification. And that is because when we did a study of some local districts around us, some classifications, there didn't need to be, to quote, stay competitive around the 50th percentile, that a smaller increase could still keep us competitive and at that 50th percentile. But other classifications needed more than the compensation of what it would be for a flat rate for everyone. So I just want to make sure to be clear that inside of here that we have some classifications, specifically secretaries, custodians, maintenance, and cooks, that their increase needed to be more than the rest of the classifications to make sure that we were staying competitive and in that 50th percentile. Just to note the districts that we looked at for these positions, we looked at Edgewood, Fairfield, Forest Hills, Franklin, Goshen, Kings, Lebanon, Little Miami, of course, ourselves, Loveland, Milford, and Winton Woods. It was a pretty good cross-section across the southwest region of Ohio, making sure that we were doing what we needed to do. So I just wanted to make sure to point that out, that a lot of work went into making sure to try to keep us in the area of that 50th percentile with our folks that are in the classification group.
So Garth, if I was to just summarize, I think what you've said, leading into this, at least in some classifications, we're well out of whack with the marketplace.
Correct.
Right.
Yes, specifically
you-
those ones I mentioned, which would be
Right.
secretary, custodial, maintenance, and cooks.
And with the adjustments that everybody has agreed to here, we're not at the upper end of the spectrum. We're kind of right smack in the middle of the spectrum.
That's correct. So we identified what areas, what we needed to do to keep those areas around the 50th percentile, and that's reflective in what you see, which, to be even more granular about it, secretary is $1.25 on the hour, custodians $1, maintenance $1, cooks 50 cents. Those were the ones where we were way below, and in some cases, the lowest of all of the districts that I named. That increase then puts us at the 50th percentile, even knowing that some of these other districts will probably be renegotiating their contracts and they might have increases, which is we're going to have to continue to do that. All of our other classifications that weren't identified as the ones I mentioned, they're having a 25 cents on the hour increase, and that is to keep them at around the 50th percentile as well.
So again, for clarity, this agreement has been ratified by the membership.
That's correct.
All right. With that, I would want to say a thank you to everybody that's been involved in the negotiation, and thank you to our employees in this group. This agreement to me represents a reasonable, necessary step forward. It also seems to suggest to me sensitivity on the part of these employees to the overall financial health of the district, and I appreciate them, everybody working cooperatively to get to this point.
Yeah, Mr. Doherty, I would echo this what you just mentioned. It is 100% correct, and the leadership of the OPSI group, understanding where our district is and what we needed to do to stay competitive. They were reasonable, very nice to work with. It was a lot of positivity in the room. We didn't always agree on everything, but I have to tell you that the best interest of our district and of our kids was at the forefront, and I'm very pleased with how it turned out.
And thank you to them every day for the efforts that they contribute to the success of this school system.
Absolutely.
I've worked with them before on contracts, and they are a phenomenal group of people to work with. They just are.
Any other questions?
The advent of free lunch for breakfast, or free breakfast and lunch, did we need to change staffing and food services?
As of right now, there isn't. There was some internal shifting of where some employees might be, but it was just some shifting of the number of people at building A needing to be at building B, but not an increase as it stands right now.
Any other questions or discussion? All right, then let's vote on that.
All right, I will start it off with a yes. Mr. Doherty,
Yes.
Dr. Lorenz,
Yes, should I let Ms. Pettit say it for me?
Ms. Pettit,
Dr. Lorenz says yes. Ms. Pettit says yes.
Dr. S.
Yes.
Motion carried. Thank you all very much for your work and comments on that. And that is a very positive event this evening in the meeting. We now have one item left on the agenda, and that is an executive session to consider the employment of a public employee or official. I cannot say whether or not for sure there will be action after. I do not believe that there will be. This is concerning the process of hiring a permanent treasurer. So it's not, just so people don't think that there's an announcement ready to be made yet. This is just an executive session to consider that process. So I don't believe that there'll be any action items after we come out of executive session, just for the purpose of our audience. I would entertain a motion to enter into executive session to consider the employment of a public employee.
Can I ask something real quick? Sorry.
I don't move.
Just because there have been questions out there, a quick comment on where we are with the teacher contract and negotiations. Like, just, it's still ongoing, right? And
I would
being
state
worked
that
on and-
that the negotiations are ongoing. It's being worked on.
okay. Fair enough.
And just to be a little more clear, we have another meeting scheduled.
There isn't a need right at this time for another meeting. The association is working with their group to get that ratified on their end. And then hopefully the time frame is going to line up to where we might be able to discuss that. You guys would be able to discuss that as a board as a part of the August 31st meeting. That is our hope, that we can wrap that up.
Okay, thank you.
Now I move.
Now you move to enter into executive session. So Ms. Pettit moves. Is there a second?
Second.
Dr. Switchenow seconds. Mrs. Washburn, can we vote on that?
Yes, Mr. Doherty,
Yes.
Dr. Lorenz,
Yes.
Ms. Pettit,
Yes.
Dr. Schwitzenau,
Yes.
and yes.
Motion carried. I have us going into executive session at 8:11. And we will be pausing the Zoom recording, and we will come back to adjourn the meeting after the executive session is over.
Getting.
Let's see, we've got everybody back at the table. Oh, you're not, you signed out, is that right? Let me put you back in. Are we set to go? We are back from executive session. I have us coming out of executive session at 9:12. Took us a couple minutes to get a minute to get the technology taken care of. The only item of business to come before the board at this point is a motion to adjourn.
So moved.
Oh, no.
Dr. Swetchnall moved. I'm assuming that
I
Ms. Pettit is
second.
seconding. And I will ask Mrs. Washburn for a roll call vote.
Dr. Lorenz.
Yes.
Ms. Pettit,
Yes.
Dr. Schwitzenau.
Yes.
I vote yes, and Mr. Darty.
Yes, thank you.
Motion adjourned at 9:14.
Thank you.
Thank you all.